Hi, my name is Ishmael Blankson. My presentation is based on pharmacological drug called Azacitidine. Azacitidine is a drug that has revolutionized the treatment of certain types of cancer and is a chemical analog of cytidine, a nucleoside in both DNA and RNA. It is also a chemotherapy drug that works by slowing or stopping the growth of cancer cells in the body. It is also commonly employed in the treatment of myelodysplastic syndrome, myeloleukemia, and juvenile myelomonocytic leukemia. In this case, the MDS are a group of cancer in which immature blood cells in the bone marrow do not mature, and as well as the JMLS are a rare form of leukemia that affect children with the age of 4 or less. And it is also an important drug in which fight against cancer because it can help patients to live long and also improve their quality of life. The mechanism of action talks about the process by which the drug functions to produce a pharmacological effect. Azacitidine is a cytidine analog that incorporates into both DNA and RNA. It leads to inhibition of DNA methyltransferase and subsequent hypomethylation of DNA. And it is also incorporated to a lesser extent into DNA, which is compared with RNA, and its inhibitory effects on DNA synthesis, which is much greater than RNA synthesis. This results reactivate of tumor suppressor genes and restoration of normal cellular function. Incorporation into DNA, azacitidine non-competitively inhibits the enzyme DNA methyltransferase. DNMT1 is actually an enzyme which is responsible for DNA methylation inheritance. This azacitidine is therefore causes a block in cytosine methylation. In conclusion, azacitidine induces apoptosis and cell cycle arrest in cancer cells by upregulating p53 and downregulating BCL2, which is the two main important proteins involved in cell regulating survival and death. Therapeutic azacitidine is a medication used to treat myelodysplastic syndrome, which is a group of disorders that affect blood and bone marrow. It also works by inhibiting DNA methylation, which can help to restore normal cell growth and prevent the development of cancerous cells. Some studies have actually shown that azacitidine can significantly improve survival rates in patients with MDS, particularly with those with higher risk of disease. And again, with this same drug has also well tolerated by patients with few serious side effects. This has made it an attractive option for those who may not be able to tolerate more aggressive treatment. In preclinical studies, azacitidine has demonstrated significant anti-tumor activity in a variety of cancer cell lines. And again, preclinical studies have also shown that this drug can enhance the immune response against tumor by increasing the expression of certain antigen on the surface of cancer cells. With the clinical studies, a recent analysis of clinical data suggests that certain genetic mutation may affect patients' response to azacitidine. A phase 2 trial shows that azacitidine was effective in treating elderly patients with AML who were not candidates for intensive chemotherapy. And also in a phase 3 trial, azacitidine was shown significantly improve overall survival in patients with higher risk MDS compared to conventional care regimens. A graph which shows an overall of patients with this MDS treated with azacitidine and conventional care, and also specifically mutations in genes involved in DNA damage repair and apoptosis were associated with a poorer response to treatment, while mutations in genes involved in RNA processing and splicing were associated with a better response.